What if I told you that one breathing habit you're doing right now, possibly at this very moment, is exhausting your lungs, wasting enormous energy, creating chronic oxygen deficiency, and accelerating respiratory decline faster than smoking, yet 90% of people over 60 do this constantly without realizing it's destroying their breathing efficiency and their health. Right now, millions of seniors are breathing in a way that makes every breath 10 times harder than it needs to be, forcing their lungs to work desperately to get adequate oxygen, exhausting their respiratory muscles, and creating a state of chronic breathlessness that they think is aging or disease when it's actually a correctable breathing habit. Meanwhile, those who discovered this destructive habit, corrected it, and retrained proper breathing are experiencing transformations within days, breathing easier with less effort, having more energy, sleeping better, and reversing decline they thought was permanent. This isn't about obviously harmful behaviors like smoking or exposure to pollution. This is a subtle breathing pattern that seems completely normal, that you've probably been doing your entire life without anyone ever telling you it's wrong. It feels natural because it's habitual, but it's actually the opposite of how your respiratory system is designed to function. Every breath you take using this pattern forces your lungs to work much harder for less oxygen, exhausts the wrong muscles while weakening the right ones, and creates a cascade of problems throughout your body from chronic oxygen insufficiency to sleep disorders to cardiovascular strain. In the next few minutes, I'm going to reveal what this destructive breathing habit is and exactly why it's so harmful. I'll explain the specific mechanisms by which this pattern exhausts your lungs and damages your health. I'll teach you how to recognize if you're doing it and how to correct it immediately. And I'll share the powerful stories of people whose chronic breathlessness, fatigue, and declining health reversed within days to weeks simply by changing this one breathing habit. You might be breathing wrong right now as you watch this. Learning to correct it could transform your breathing, your energy, and your health starting today. If you feel breathless frequently, if simple activities exhaust you, if you wake up tired despite sleeping adequate hours, if you feel like you can never get quite enough air, you've probably blamed lung disease, heart problems, or inevitable aging. Maybe you've been told your lungs are fine but you still feel breathless. Perhaps you use inhalers that don't help much. You might have been through extensive testing that found nothing definitively wrong, yet you still struggle to breathe comfortably. What if the problem isn't disease but a fundamental breathing pattern dysfunction that nobody has identified because nobody taught you to observe how you actually breathe? Here's what almost nobody understands about breathing mechanics and efficiency. There's a correct way to breathe that uses your diaphragm, the powerful dome-shaped muscle below your lungs designed to do the majority of breathing work. This diaphragmatic breathing is efficient, effortless, and provides optimal oxygen delivery with minimal energy expenditure. Then there's the wrong way to breathe, using your chest and accessory muscles in your neck and shoulders, forcing these small, weak muscles to do work they weren't designed for. This chest breathing is inefficient, exhausting, and provides inadequate oxygen despite enormous effort. Most seniors, and increasingly people of all ages, are chronic chest breathers. They've lost the natural diaphragmatic breathing they had as babies and developed dysfunctional chest breathing patterns through years of stress, poor posture, shallow breathing, and lack of awareness. They're working 10 times harder to breathe than they need to, exhausting themselves with every breath, yet getting less oxygen than they would with effortless diaphragmatic breathing. The tragedy is that this dysfunction is completely correctable, often within days to weeks of conscious retraining, but most people never learn that they're breathing wrong or how to fix it. Most doctors never assess breathing patterns during routine examinations. They check lung function with tests that measure capacity but don't observe how you actually breathe throughout the day. They prescribe medications for breathlessness without addressing the fundamental mechanical dysfunction causing it. You're left struggling with a breathing pattern problem that's creating breathlessness and exhaustion, never learning that simple retraining could solve the problem more effectively than any medication. Thousands of seniors who discovered they were chronic chest breathers, learned proper diaphragmatic breathing, and practiced retraining until the correct pattern became automatic, described transformations that seemed miraculous. Chronic breathlessness that had limited their lives for years resolved within weeks. Energy that had been depleted by inefficient breathing returned. Sleep quality improved because nighttime breathing became efficient. Activities that had been impossible became easy again. All from correcting one fundamental breathing pattern dysfunction. Now let me reveal the destructive breathing habit and explain exactly why it's so harmful. The common habit that's exhausting your lungs fast is chest breathing, also called thoracic breathing or shallow breathing, where you use your chest muscles instead of your diaphragm to breathe. Right now, place one hand on your chest and one on your belly. Take a normal breath. Which hand moves more? If your chest hand moves significantly while your belly hand barely moves, you're a chest breather, and this pattern is exhausting your lungs and damaging your health. Let me explain exactly what's wrong with chest breathing and why it's so harmful. Your diaphragm is a large, powerful, dome-shaped muscle that sits below your lungs, separating your chest cavity from your abdominal cavity. When it contracts properly, it flattens downward, pulling your lungs down and creating negative pressure that draws air in efficiently and effortlessly. The diaphragm is designed to do 70 to 80% of breathing work. It's strong, efficient, and can work continuously without exhaustion because it's built for this specific job. When you breathe from your chest instead, you're using the intercostal muscles between your ribs and accessory muscles in your neck and shoulders to expand your ribcage and draw air in. These muscles are small, weak compared to the diaphragm, and weren't designed to do primary breathing work. They're meant to assist during times of maximum exertion, not to do continuous breathing. When you force them to do the diaphragm's job, several harmful things happen. First, chest breathing is extremely inefficient. You use much more energy to move less air. Your small chest muscles work desperately to expand your ribcage, using 10 times more energy than your diaphragm would use to accomplish the same air movement. You're exhausting yourself with every breath, burning energy that should be available for other activities, all to get less oxygen than you would with effortless diaphragmatic breathing. Second, chest breathing uses primarily the upper portions of your lungs, which are the least efficient areas for gas exchange. Your lower lungs, where the richest blood supply exists and where gas exchange is most efficient, barely get ventilated. You're moving air in and out of the wrong parts of your lungs, getting poor oxygen uptake despite all your effort. Third, chronic chest breathing keeps you in a constant state of mild oxygen deficiency. You're never getting fully adequate oxygenation because your breathing is so inefficient. This chronic oxygen insufficiency affects every system in your body. Your brain function suffers, causing brain fog and poor concentration. Your energy is depleted. Your cardiovascular system has to work harder to compensate. Your sleep is disrupted because nighttime breathing is inadequate. Your physical capacity is limited because muscles can't get the oxygen they need. Fourth, chest breathing activates your sympathetic nervous system, your stress response. The physical pattern of chest breathing with visible shoulder and neck muscle use signals to your brain that you're in danger, triggering stress hormones and anxiety. Chronic chest breathers often have chronic anxiety and stress that's partly driven by their breathing pattern, creating a false danger signal. Fifth, chest breathing weakens your diaphragm progressively. Like any muscle, the diaphragm gets weaker when it's not used. As you chest breathe year after year, your diaphragm atrophies and becomes less capable of proper function. Even if you try to breathe correctly, your weak diaphragm can't do the job anymore, trapping you in the dysfunctional chest breathing pattern. The consequences of chronic chest breathing are severe and progressive. Constant breathlessness and feeling like you can never get quite enough air. Chronic exhaustion from the enormous energy waste of inefficient breathing. Poor sleep quality and morning fatigue because nighttime breathing is inadequate. Anxiety and stress partly driven by the breathing pattern itself. Progressive weakening of the diaphragm making the problem worse over time. Reduced physical capacity and exercise tolerance. Brain fog and poor concentration from chronic oxygen insufficiency. Over years, chronic chest breathing accelerates aging and decline across all body systems. Research shows that the majority of people over 60 are chronic chest breathers. The pattern develops gradually through years of stress, sedentary lifestyles, poor posture, and lack of awareness. Most people have no idea they're breathing incorrectly because nobody ever taught them proper breathing or assessed their patterns. They struggle with breathlessness and exhaustion, trying various medical interventions, never realizing that simple breathing retraining could solve the problem. Now let me teach you how to recognize chest breathing, how to retrain proper diaphragmatic breathing, and how to make correct breathing automatic. This retraining process takes conscious practice but produces results within days to weeks for most people. Step 1 is assessing your current breathing pattern. Lie on your back in a comfortable position. Place one hand on your upper chest and one on your belly just below your ribcage. Breathe normally without trying to control or change anything. Simply observe which hand moves more. If your chest hand rises significantly while your belly hand barely moves, you're chest breathing. If your belly hand rises noticeably while your chest hand stays relatively still, you're breathing correctly from your diaphragm. Most seniors will find they're chest breathers when they do this assessment. Step 2 is learning proper diaphragmatic breathing technique. Stay lying on your back with hands in position. Now breathe intentionally from your diaphragm. As you inhale through your nose, focus on making your belly hand rise while keeping your chest hand relatively still. Your belly should expand outward and upward as your diaphragm contracts downward. This feels backwards to chest breathers because you're used to your chest rising. Persevere. As you exhale, your belly should fall as your diaphragm relaxes back to its dome shape. Practice this for 5 minutes, focusing on smooth, deep belly breaths where the belly hand rises prominently and the chest hand barely moves. Step 3 is practicing in different positions throughout the day. Once you can do diaphragmatic breathing lying down, practice sitting. Sit upright with good posture, hands in assessment position, and breathe from your diaphragm. Then practice standing. Then practice while walking slowly. The goal is making diaphragmatic breathing your default pattern in all positions and activities. Practice multiple times daily, minimum 3 sessions of 5 minutes each, until correct breathing starts feeling natural. Step 4 is using strategic reminders to check and correct throughout the day. Set hourly reminders on your phone or watch. When the reminder sounds, stop and check how you're breathing. Place your hands in position and observe. If you've fallen back into chest breathing, consciously shift to diaphragmatic breathing for a few breaths. Over weeks, these frequent checks and corrections retrain your default pattern. Step 5 is strengthening your diaphragm to support the new pattern. Your diaphragm may be weak from years of disuse. Strengthen it by practicing resistance breathing. Lie on your back with a light weight, 1 to 3 pounds, on your belly. Practice diaphragmatic breathing, lifting the weight with each inhalation. This resistance strengthens your diaphragm like lifting weights strengthens other muscles. Do this daily for 5 minutes. Let me tell you about Dorothy, a 70-year-old woman who had been experiencing severe breathlessness for 3 years that progressively worsened despite multiple medical evaluations finding nothing definitively wrong. She could barely walk 1 block without stopping to catch her breath. She was exhausted constantly. Her doctors prescribed various inhalers and medications with minimal benefit. She was becoming depressed because she felt her life was over, limited to her home because breathing was so difficult. Then Dorothy was referred to a respiratory therapist for pulmonary rehabilitation. The therapist immediately observed that Dorothy was a severe chest breather, using visible neck and shoulder muscles with every breath, her chest heaving dramatically while her abdomen barely moved. The therapist explained that Dorothy's breathlessness wasn't from lung disease, her tests had shown reasonable lung function, but from profoundly dysfunctional breathing mechanics that were exhausting her. The therapist taught Dorothy diaphragmatic breathing and had her practice lying down. Dorothy was shocked that something so simple could be wrong and that nobody had identified it before. She practiced diligently, lying down for 5 minutes 3 times daily, focusing on belly breathing. Within 3 days, Dorothy noticed she felt less breathless during daily activities. Within 1 week, she could walk farther without stopping. After 2 weeks of consistent practice, Dorothy's breathing had improved so dramatically that she could walk 3 blocks comfortably, something she hadn't done in 2 years. Dorothy continued practicing, and within 6 weeks, diaphragmatic breathing had become largely automatic. She no longer had to think about it constantly. Her breathlessness was gone. Her energy had returned. She was active again, doing activities she'd given up. Her transformation was so dramatic that her primary care doctor, who hadn't seen her during the 6 weeks of retraining, was stunned by the change. Dorothy credits learning correct breathing with saving her life and giving her back her independence. The key to success with breathing retraining is consistent, conscious practice until the correct pattern becomes automatic. This typically takes 4 to 8 weeks of dedicated practice for most people. You must practice multiple times daily, check and correct throughout the day, and persist through the initial awkwardness of doing something that feels unnatural because it's different from your habitual pattern. Common obstacles include finding diaphragmatic breathing difficult initially because your diaphragm is weak, feeling like you're not getting enough air when you first switch patterns because you're so used to the chest breathing sensation, and repeatedly falling back into chest breathing when you're not consciously attending to it. All of these are normal and resolve with consistent practice. Your diaphragm strengthens, the new pattern starts feeling satisfying, and it gradually becomes more automatic. Respiratory therapists and breathing specialists recognize chest breathing as a primary dysfunction underlying many cases of chronic breathlessness. Research on breathing patterns documents that diaphragmatic breathing is significantly more efficient than chest breathing, using less energy for greater oxygen uptake. Studies on breathing retraining show substantial improvements in breathlessness, exercise capacity, and quality of life when chest breathers learn proper diaphragmatic technique. The insider knowledge is that breathing pattern dysfunction is extremely common but rarely addressed in conventional medicine. Most doctors never observe how patients actually breathe. Physical therapists and respiratory therapists are trained to recognize and correct these patterns, but most patients never see these specialists unless they're severely ill. Simple breathing pattern assessment and retraining could help millions of people but isn't part of standard medical care. Here's something that will shock you. Research comparing energy expenditure during chest breathing versus diaphragmatic breathing found that chest breathing uses 8 to 10 times more energy to move the same amount of air. You're literally exhausting yourself 8 to 10 times faster than necessary with every breath. The revelation is that your chronic fatigue and breathlessness might not be disease. It might be breathing wrong, working 10 times harder than necessary for inadequate oxygen, exhausting yourself with every breath you take. When you retrain diaphragmatic breathing and experience the effortless breathing and energy transformation it produces, the psychological impact is profound. Relief replaces exhaustion when breathing becomes easy instead of constant struggle. Confidence replaces fear when breathlessness resolves. Energy and vitality return when you're no longer wasting enormous energy on inefficient breathing. Quality of life transforms when breathing stops limiting everything. We've revealed the destructive breathing habit exhausting your lungs. Chest breathing using neck, shoulder, and chest muscles instead of your diaphragm is inefficient, exhausting, inadequate for oxygen needs, and progressively damaging. Proper diaphragmatic breathing where your belly rises with inhalation is efficient, effortless, and provides optimal oxygenation. Check your breathing pattern right now. Place hands on chest and belly. Breathe normally. Which moves more? If your chest moves more, you're breathing wrong and exhausting yourself. Start retraining today. Practice diaphragmatic breathing lying down for 5 minutes 3 times today. Continue daily. Check and correct throughout each day. Within weeks, correct breathing can become automatic and transform your breathing, energy, and life. Your breathlessness and exhaustion might not need medications. They might need breathing retraining. Stop exhausting your lungs with chest breathing. Learn proper diaphragmatic breathing today. Your transformation could begin with your next breath.